Can you pass that? Yes, the seeds. I will record for the students and the turmeric also. So, how I will show? Okay, yes, I can show like this. Okay. So, yeah, this is clear. This is Saunf, Shatapushpa, and Jeera. This is cumin seeds. So you can see the difference also. And this is fresh turmeric. You can see here, we just take it out like this. You can see my finger is, yellow. And this I just take out. See, you can see the color now. See. So this is the fresh turmeric. Yeah, in market, loss of adulteration is there. So sometimes we are not very sure that what it will be. Okay. So they have tasted it. So I'm sorry, you cannot taste it right now. Let me just put it in the plugs. Be more clear. Okay. Okay. So let's continue. The next chapter, number 18, cause of the diseases in Ayurveda. Right. So what are the cause of diseases? So this is the last segment we are doing. And if you guys are there, so next time we can plan some practicals. So far we have done 2 practicals, no? 2 or 3. We did head massage and just 1. Okay. So if at least 3 of you are there, so let's do practical next time. That will be better, no? Okay. We will do Nasya, and if we get time, we will do Netra Tarpana. So let's do 2 practicals next time. So because time is less, we have to finish. Okay. So this is the last part now starting, and the last part is all about disease. How disease happen? What is the Ayurveda understanding? How we take the history of the client? What type of tests generally we do? What tests were recommended in the textbooks? Now we have changed a little bit. What kind of tests we needed? So all these things, just to give you an idea, basically, that how it is happening. So in future, if you want to take benefit or advantage of this, so at least you have clue. Okay, so cause for the disease in Ayurveda, what we understand the why disease happen. Causes for disease under normal circumstances, all doshas, dhatus, mala remain in equilibrium stage when everything is good. Their functions, qualities, quantity remain stable, so no disease can happen while in this condition. But whenever these equilibrium disturb due to various reasons, problems may happen. So mostly everybody knows their work, everybody knows what the functions I have to perform, and they remain in a very balanced stage, taking care of each other, and very happily they make the body. But sometimes, because of things, the equilibrium may disturb. And that's how we understand that the problem may start. Okay. Most often, Agni is responsible, and the Ama is one of the reasons for various problems. Ancient times, probably, it was Ama. And now also it is Ama, because ultimately, all things will result in Ama, even if it is stress. I think these days it is more stress, not just the food. But because of stress, we make Ama, right? Because our digestion becomes weak. So in nutshell, whatever the situations, whatever the things will be, human body for the 1000 or more years, the philosophy is same. Because of stress, our hormones will not work properly, our digestive juices will not work properly, our food will not be digested nicely, and the ama will start circulating in the body. Reason can be bad food, reason can be bad digestion, reason can be liver failure, or reason can be stress. That everything is good, but stress is harming our digestion. It can be anything, right? But ama will happen, and ama is the reason for all chronic problems, autoimmune problems, cancers, right? So ama is the main creator for all these things, except I think bacterial infection. Rest all is under ama. You say high blood pressure, you say heart attack, you say diabetes, you say cancer, you say rheumatoid, anything which is just because of the lifestyle stress problems is because of the ama. So whenever doshas are in neutral state, that is called prakruti of the body, and if they are disturbed due to various reasons, it is called vikruti. We have understood that before, prakruti and vikruti. So vikruti is diseased or unhealthy states. So because of all these reasons, problems can be of two types. One is because of increased dosha, and the second is because of decreased dosha. इतना ही मिला सुनीता, ज्यादा नहीं था। मैंने कहा था ना, दो दो मुट्ठी तो ले आइए, ये लोग घर लेके जाएंगे। चलो छोड़ के जाते हैं। This is fresh coriander, because you have not right now there are no big leaves because season is finishing. So this is fresh coriander, this is mint, and Sunita. So this is basil. You want to try something? You can try. Let me just show. Yeah, this is coriander leaves, but it's almost finished now. Mint and three kind of basils. Okay, you can try. It's all washed. What causes fertility? Okay. When we say that it is equilibrium of the doshas, you can very well understand the why equilibrium will disturb. Equilibrium will disturb in two ways only. This way or this way. Simple, isn't it? It will go this way or this way, right? So this is one type and this is another type. So two type of problems will be there. And another one will be misuse. This is over, this is less, and this is misuse. Right? Means you are using something too much, you are using something too less, or you are just misusing. That will also disturb. Okay. So these are the three type of basic problems will happen. Overuse, misuse, and less use. This is the problem of the dosha with the sense organs. See, we are everything by our five sense organs we are understanding. Either it is eating, then tongue is involved. We are listening, ear is involved. If five sense organs are not there, we do not know if the person is existing or not. Something will be on my skin. Even if I cannot listen, smell, eat, nothing, still I can feel that my skin is still alive. If I cannot feel, I cannot see, I cannot hear, I cannot eat, I cannot smell, I cannot speak, so probably I am no more. Right? So everything we are doing, interaction with this world, is with sense organs. Either we are listening, either we are seeing, either we are eating, either we are, So everything comes through five sense organs. When five sense organs are not working and they are just little resting, so we are sleeping. We are all no more in senses, right? So five sense organs are the main reason we are taking every day from this world. And how we use sense organs, either we will be using too much, we will be using too less, or we will be misusing. What is that? Like overuse means that, let's talk about speaking. We are just speaking so much. We feel so stressed. Sometimes when we talk, we feel so stressed, right? And less use, that you are not using it. That is also, you are keeping so much inside. You want to speak out, you want to say something, but you are not. You are hurting yourself somewhere inside. Misuse is that every time I am talking bad, the speak was to given to release myself, to tell my emotions, to speak my feelings. But every time I am abusing, I'm talking negative, I'm doing something, which can harm others. That is the misuse, right? I'm misusing it. Watching violence, misusing my eyes, listening to the abusing language, misusing my ears. So this way, or eating too much of sugar, misusing my tongue. So like that, either we are doing too much, we are doing too less, or we are misusing it. And that is the reason for hormonal imbalance. And in Ayurveda, we say dosha imbalance. So our whole system will be in bad shape. Our doshas, which keep on getting, it's like this always, every nanosecond in the body, it is like this. Something increasing, something decreasing, something increasing, decreasing, right? And body is trying to balance itself all the time, right? But some of the day, when it keeps on getting high, so it is imbalance. We will get sick. Okay. So, like seeing too much violence or reading in less light can prove problematic. So, doing like this for long times will spoil dosha equilibrium. It may increase some or decrease some, which may cause problem. Doshas may affect any part where they stay directly or indirectly. So it can be primary location or secondary location. Maximum of doshas later start spoiling the organs. And as most of the work for body happens in the digestive tract, so some symptoms arise from there first and start spreading to other organs. हाँ सुनिए, क्या ले आई तो दे दे. Okay, please take. I told her, why you are bringing so less? There are so much upstairs, and you are bringing just to taste. They have to take home. So she said, okay, let me go back. I said, okay, go back. Please take. Maybe later on you can. But one thing is that never wash the greens. Wash when you have to use it. If you keep on washing it and collecting it, it may spoil little more fast. So when you go home, please dry it, because we are not spraying anything, so they are just fine. Only dust will be there maximum. So I do not have any sprays or anything. Okay. So next time when I will give you without washing. So right now she bought it. She already washed it. Okay. So just spread it a little bit, and when it becomes dry, then you can refrigerate it. Okay. Plant. I will. I have many babies. Yes. I will collect and will message you. So whenever you are passing through here, please collect. Okay. Yeah, this is very nice. Okay. Yes, if you can grow. Yeah. Okay, so doshas may affect any part where they stay directly or indirectly. So it can be primary location or secondary location. Now we know the doshas locations, right? Upper body is mostly kapha, though in every cell, again I'm saying, every cell has all the three. But there are some primary locations, like upper part is for kapha, middle part is for digestion, pitta, and lower part, excretory organs, comes under vata. Okay. So anywhere problem can happen. It can be the primary location or it can be anywhere in the body. Maximum of doshas later start spoiling the organs. And as most of the work for body happens in the digestive tract, so symptoms arise first there and start spreading to the other organs and diseases. Collected doshas start moving from digestive system to the other part. They are more fixed tissues like arms, legs, skin. According to Ayurveda, problems will start happening first in the digestive tract. And then it will start spreading. When you keep on ignoring, and not addressing it, then it will start spreading. So these all are far away organs from the digestive tract. They start spoiling the normal tissue there. Now, what you can do, right? What we need to do is reduce the imbalances. Reduce the imbalance doshas. If they are high, down. If they are low, upgrade them. So that's how we can correct it. There are three main steps by which we can reduce these doshas. Reducing the doshas by correcting the lifestyle and herbal medicine. Bringing back the doshas and eliminate them like panchakarma. For reduced dosha, again, adopting lifestyle and herbs to increase it. So these can be the methods to remove the dosha problem from the body. So we have three type of treatments. When it is down, we do lifestyle, we do herbs to improve it, okay? And when it is high, we will again do lifestyle, herbs to decrease it. But sometimes it is so increased that to make it less can be really problematic. Then we need to cut it down. And that's the time when we need panchakarma. Right? But with the panchakarma is shodhana. Shodhana means purification, means cutting down. We cannot do anything with the herbs. We cannot do much with the lifestyle, and we really need to remove. Yes, any kind of shodhana. Shodhana means purification. Panchakarma are shodhana procedures. Purification. Lifestyle and herbs are shamana. In Sanskrit, we have two type of treatments, shamana and shodhana. Shodhana is like surgical removing, and shodhana is the removing. Shamana is lifestyle and herbs. Yes, treating by lifestyle and herbs, and shodhana is like surgical removal, like purification. Okay, so these are the ways we can treat. Now, what are that? So, in simple language, because of ama problems and various misuse of body parts, either excessive or less, cause dosha unstable conditions, which can give rise to problems. In Ayurveda, digestive tract is the mother of all problems. Maximum disease start arising from here, and ama is the main culprit in that. Right? We all understand that digestion, because of digestion starts, and ama is the one thing which will start. What are the type of doshas in Ayurveda? In Ayurveda, we understand that there are two type of doshas, Akanduj and Vahya. Mainly, main classification is this, Agantuj is the Sanskrit word, and Agantuj is Vahya also, internal, and Abhyantara, Abhyantar. So Agantuj means like a guest. In Sanskrit, we call guest also Agantuj. I have Agantuj at home today. So this disease is like a guest, right? And this is your internal problem. Means this is coming from outside. You didn't do anything wrong. And this is, you were the culprit. It was, you are making it. So the guest is like you were walking and something fall on you, like an accident, right? You fell down and you broke your leg, or you were walking and some dog bite you. So this is all no fault of yours. Like a guest, you got a problem. And Abhyantar is when you were doing continuously, you were doing wrong things. You were not taking care of the diet. You were doing everything wrong. You were not taking care of your lifestyle. So you were doing wrong things. That is Abhyantar problem. So Abhyantar will be more Vata Pitta Kapha. Agantuj will be like a sudden attack. So Agantuj means coming suddenly, like an accident, insect bite, or anything like that. Abhyantar is from inside the body because of various reasons. Abhyantar or internal disease, one can understand when a condition like bloating, indigestion, vomiting, and problem like this start happening. So disease start affecting the internal digestive system, and from here, if remain untreated, it will start giving rise to the more problems. So first, according to Ayurveda, first will be always digestion. The body will start sending signal, something wrong, something wrong, something wrong. And we keep on ignoring, and then we are in problem. So there can be further, okay. So this is the main category of the disease. Now, another category is little bit, mostly diseases will come in this category. But as it's a very sophisticated medicine, so acharyas have made another classification, which is 7 types. And what are these? Number 1 is genetic problem. In Sanskrit, it is written Adi Bala Pravrit. Adi. Adi means from the beginning. From the beginning, right? That is Adi. Bala means strength. Pravrit means push. So Adi Bala Pravrit means it is coming from the beginning. You do not know from when it started. And by a very strong force, it came to you. It is pushed on you. So what is that? Genetical problems, which is coming in your DNA. You do not know how many years, maybe 100, 150, 200 years in your genetical, this thing is coming with a very strong force, and you got this problem, right? So in Sanskrit, it is the Adi Bala Pravrit. Idenshi? Idenshi, okay, yeah. So genetical problems come under this, which can be due to defective sperm or ova, so can be maternal or paternal. Because of these conditions, defective fetus start developing. So we have the baby, which is defected. Then is the Janam Bala Pravrit. Bala is same again, strength, strong. Pravrit means pushing, like us, right? So Janam means birth, Janam Din. Janam Din means birthday. आज मेरा जन्मदिन है, means today is my birthday. So janam is birth. So janam bala pravrit means at the time of birth you got problem. You were born with a twisted hand. You were born with a defect in the heart. It is not a genetical problem, not genetical problem, right? Something happened during birth. So your DNA is fine, your genes are fine, but you had a twisted leg. You will see many children with a twisted leg or malformed ear. It doesn't mean that their whole next generation will be having the same problem. No, not necessarily, right? Because it's not a genetical problem. So that is called Janam Bala Pravrit. It is the problem which arises during formation of the fetus, can be due to faulty lifestyle of the mother or some imbalances of any kind resulting in damage to the baby in the womb. So sentency, oh, sentence, say it. Okay. So then is dosha bala pravrit. Dosha bala pravrit means because of my dosha, because I'm a kapha person, so I always have the sinus problem. This is dosha bala pravrit. Because a pitta person always will have some heat related issues. Why? Oh, this is dosha bala pravrit, right? So they have made such a beautiful classification with a very great scientific background that this is not by birth, this is not genetical issue, this is your dosha. Because in your body, by nature, you have more kapha in you or you have more vata in you. So that is the dosha bala pravrit. It happens due to our own body type. There's some problems because of our natural body constitution. We may get more than others, right? Like three people are there, and only one is getting cold and cough, right? Or 4 5 people are in the same room, same eating, same habits, everything they are doing same, but one person is getting more bloating. So means that is their body type. Then is agantuj, same. Agantuj like traumatic or bhaiya coming as a guest from outside. That is called agantuj because of any injury, trauma, bite, or sudden problem which may give rise problem to the body. That is traumatic or agantuj again. Then is seasonal. Kala bala pravrit. Kala means because of time. Bala pravrit same coming with a very strong force. Time, because this is the time of the season when the summers are there, so heat issues can be there because of the weather, because of the time. This is the day, morning time. Morning time may have some problems because this is the time of kapha, this is the time of pitta, or season is changing. So season is changing. So in the nature, this dosha is very high and it is creating problem. So like pollen allergies, flu, viral fevers, which does not have any reason, just the season is changing. Okay. So that is the Kala Bala Pravrit because of the time. It can happen because in some seasons, some problems arise because of change in the season, and some doshas can be more in the nature and thus harming the natural balance. So it causes seasonal problems, cold, cough, diarrhea, fevers, and like this. Then is Deva Bala Pravrit. Deva we say to the things which we cannot see. So it can be some divine powers. It can be some bacteria. It can be some viruses. We do not know. We cannot see who infected. So some very small microorganisms like bacteria, like virus, like a fungus. So some microbes put the infection in you. That is Devabala Pravit that we cannot see. Infections or environmental, it can happen because of some infection in the air, sharing some things, some infected food or some infected air or water. Then last is Swabala Pravit, natural disease. Understand in Ayurveda, hunger, sleep, death, aging, all is under disease. Why? Because in Ayurveda, we understand anything which makes you slow down your capabilities, or you are not enjoying it, your body feels bad about it, is a disease. So there are some natural diseases which make you slow down. That is thirst, sleep, old age, and ultimately death. So these all are the natural problems which nature has just given us, right? So these are called Swabala Pravrit. Swa means our own, as we have talked so many times. Swarasa, Swabala, so many times we use it. Swa means my own. So some people can be unhealthy because of hunger, thirst, sleep, death, or just old age, or any other natural reason for death or getting old. So in Indian system, it is very probably it is a good thing also that in old age we do not keep on complaining, you know. So if you talk like to my parents, and if I ask how are you, so she will be saying, oh good, very good. So some joint pains, and so in old age everybody gets little bit, I cannot be same, so it's okay, no worries. So means they take it positively that we are aging, so some problems will be are acceptable, that we do not look same, we do not have the same power, we cannot understand same way and quickly. So they never complain. They will say, oh, accept the aging problems and nothing serious. So they feel very happy that that this is the, because that is a good thing also, because always complaining for the problems which has no solution, right? Aging is something which everybody has to go through it. So something can happen, of course, until unless you feel good, you are eating well and you are sleeping good, should be good. Just normal body aches, normal today I'm not feeling very good. So all the time you cannot keep on complaining, right? So that is a good thing also, that you are positive and you take it as a blessing that you are still good, because there is a very good saying that you don't want old age, right? Nobody want to get old, but the other option is also not good. So okay, let me get old. Right. So other option is not good either. So it's better to get old, right? Okay. So these are the type of diseases in Ayurveda, 7 types. So we still have time. Let's go to the chronology also. Any question? Do you have question, or shall we continue? Continue? Okay. So we will be talking about now chronology, Nandai. So chronology is very important, because if you know the chronology of the problem, you can still handle it at some level. So these are the type of diseases causing situation in human body. In nutshell, there is a chronology for any problem to happen. Charaka said about increasing the life and keeping the people as healthy as much possible. Charaka says that please keep your life long and try to be as healthy as possible, that you can do your daily work. So for that, you need a chronology that, okay, I have a problem now, what to do. So he said that at any stage, you can get alert. So he said that what is the first thing? First thing is hetu, Ryu. So he said that reasons. If you know the reasons, you can stop, right? Like my arm is, getting, oh, okay, I know the reason. Okay, let me just, relax. So I understood the reason. So many times it will happen that you are working in a chemical factory, and working with the chemicals, and you have eczema or dermatitis or something. And oh, I have a problem. Oh, I have a problem. Applying steroids and eating so many medicines. Oh, understand that there is a reason. Why don't you remove it? Why don't you use some gloves or take some break or do not use that chemical directly on your skin when you know? So, first is understand the reason. That is the basic thing. Remove reason. Do not keep on, oh, let me treat it. Let me treat it. Oh, you are not removing the reason. So, first he said, understand the reason. If you know the reason, remove it immediately. So, in the chronology, then hetu means reason, meaning to remove any type of cause which can cause problem. One should be aware of these causes and try to prevent it. When you know that this thing is causing problem, take care, remove it. Next is linga. Linga means chikibetsa. Chikibetsa. Yeah, chikibetsa. Okay. Yeah. So that is identification. So even if it started, if we understand the problem without getting it in bad or spreading stage, we can stop it somehow. Next is identification. I'm not understanding what is causing problem, that I'm inhaling the smoke and getting lung infection, right? And everybody is saying, you are coughing a lot. No, I'm fine. So, oh no, you are coughing. Many times I saw you. No, might be just like, I'm fine. You are not identifying your problem, that you are into problem. You are saying, no, I'm good. Nothing is happening. So second thing is that identify the problem. Understand there is a problem. Until unless you will not understand, there is no point. Okay. So he said, very, very important to understand and identify the problem. Even if it started, we can, if we understand the problem without getting it in bad or spreading stage, we can stop it. Next is medicine. Probably you did not stop at Hetu, you did not stop at Linga. Now, okay, please understand there is a medicine. There is a treatment. Okay, treat it. Next is medicine. That is which herb or medicine is going to help you in which vyadi. Vyadi means disease. So now once disease is already there, know how to stop it without getting bad further. Okay. So this is according to Acharya Charaka, that there are 3 stages chronology of the problem. Understand and stop wherever you can. Other views of the Acharya. So Acharya Sushruta, yeah, he gave a little bit different chronology, because the one was the Acharya of medicine, one was the different thought of surgery. So they always have a different view. So Acharya Sushruta said that there will be a chronology, that in first Prakriti or Purusha, we need to check. You need to understand what is your body type. I'm a kapha person, so please take care of the kapha problem, kapha food. He said, first will be always Prakriti or Purusha, that before understanding anything else, let me understand first who you are, what type of problems you are born with, or what type of a body you have. So he said, first is the here. So he emphasized in understanding the body type or constitution first. Purusha is the sum up of 5 elements and soul, because we all have 5 elements and we have a soul. It is living mass and a body. It is the human body with consciousness, which is called Purusha in spiritual terms. So a Purusha is required to get the disease. To get sick, we need a Purusha. Right? We need a body to get sick. So he said, before jumping to the reasons and this and that, let me first understand who is this, right? Oh, okay, this, okay, kapha, okay, this, vata, right? So he said, first understand, oh, old age person, okay, so maybe some other problem. So he said, first is the body. Then is the disease. He said, then next you need to understand the disease, what kind of problem he is having. Means knowledge of the problem, what type of problem, what is the diagnosis, what is the prognosis. Whichever give rise to the pain and comfort is called disease. It can give pain to the body and mind or soul. It can come from any type which we discussed about. Right? So he said, second is the understand the problem. Third, he said, is the treatment. After this comes the medicine, that you should have a complete understanding which herbs are going to be beneficial. So he said that in any disease, we need these three. First, the body. Second, we need to understand the disease. And third, we need to understand the medicine. So this is the, according to the Acharya Sushruta, the chronology of the problem. Right? So these are the different Acharyas' views in chronology. And okay, shall we stop? Okay, so we stop here and let me just